Okay, how about weight gain? Because that seems to be another accepted thing. You know, I'm middle-aged, I'm not burning the calories as quickly. Right. You're saying that
hormones control our metabolism. They absolutely control our weight. So if your hormones are off, you're going to gain weight and you're not going to be able to lose it. So that's a really important factor as well. And then if people really, really need to lose weight, there is also a hormone-based diet, the HCG diet that we offer at my clinic that's very effective for weight loss as well.
Speaking of weight loss, I've got Maria from Walnut Creek. Good morning, Maria. You're on the air.
Hello.
Hi, Maria. Do you have a question for the doctor?
Yes, I do. I'm in menopause, going in for the second year, and I had tremendous amount of weight gain. To me, it's totally devastating.
Very common. Very, very common. So again, you know, when a person is deficient in estrogen, progesterone, testosterone, and often even thyroid, okay, most people's thyroid function does decline with age. So a lot of people will be very on the low normal end of thyroid function, and their doctors say you're fine, but if they were moved up to the high normal end, they would feel a lot better and be able to lose more weight. So it's much easier to lose weight when you have your hormones.
Okay, so menopause is generally the time when women, for those who've never experienced it, start experiencing what? Weight gain, hot flashes, night sweats.
Right.
What are some of the other symptoms?
And a lot of brain fog kind of symptoms. People complain that they worry that they're losing their mind or losing their memory. So it's a very common symptom.
Well, at what age should you actually start checking your hormones, and what's the process for checking hormones? Is there a test?
It's a simple blood test. It's very easy. Any doctor can order it. So it's like estradiol for estrogen, progesterone, testosterone. These are blood tests that any lab can run, and it's just a lot of doctors won't run them. But there's a broad range for hormones from low to high, and some women may be down here and the doctor says again you're okay, whereas they'd feel a lot better if they were up at the upper end.
I mean, it's my understanding though that hormones kind of fluctuate throughout the day.
They do.
So is there a test that actually
well, that's why we have ranges.
Reading?
That's why we have ranges. And there's also saliva tests, and then there's even urine tests that can be done that are more advanced. So, but it's a fairly easy screening test with just a simple blood test.
Now, you mentioned, okay, we understand a general sort of what is a normal hormone range for your age group.
Right.
So what's optimal where you're really pushing those limits where you're feeling a lot better?
Well, integrative medicine doctors like myself tend to try to get people, no matter what their age, we're looking for a hormone range that you would have had in maybe your 30s or 40s. And so it's important to start checking hormone levels at about age 30, 35, because especially progesterone starts to decline in the early 30s. And so we want to have a balance between estrogen and progesterone. We don't want to have more estrogen than progesterone, because that balance is very important for preventing cancer.
Well, it seems like you have to do some fine-tuning as you go along as well.